Assalamu alaikum. Welcome everyone on board. The topic or discussion I just want to do today is I have done multiple times before as well. I was just today. I just want to repeat a number of things, and just can anyone volunteer who can have a conversation? And Dr. Bisma, Dr. Sadaf, anyone please, anyone of you. I will just ask you a question, and then I will. I just want to know how you study. Who want to speak out, please? Any volunteer, please?
Assalamu alaikum, sir.
Walaikum salam. Yes, Dr. Sadaf.
Study में कोई proper
just try to conversate. Your voice is distorted, unfortunately. Anyone else, please? Anyone else, please? Dr. Bisma.
तो इस तरह से नहीं मिलते हैं, लेकिन
Dr.
जब भी टाइम मिलता है
Sadaf,
बुक खोलने का तो कम मिलता है, तो फिर
Dr.
YouTube पे
Sadaf,
कोई वीडियो,
Dr. Sadaf,
कोई मटेरियल जो
Dr. Sadaf, unfortunately, I need to mute you because there are some international speakers, so we have to conversate in English. Your voice is distorted, so unfortunately, you are not being listened. So anyone else, please? Anyone else wants to speak out, please? Dr. Bisma?
Sir.
Yes, Dr. Hasham.
So what I have learned in the practical anesthesia is that what we do in the theaters, and we try to study that from relevant articles,
okay,
or from some textbook, that particular topic.
Okay.
What we do
So,
in the theater.
Okay, so what topic? I just want to get an example.
If we do today lab
But
we will go
what
to the
last?
what relevant
last?
article or concept.
Is my voice clear to you? Yes. Yeah, Hasham, if you can just answer me again, that which last topic did you study?
Sir, I basically went through pediatric anesthesia.
Pediatric anesthesia.
The last scenario which I faced was it was an intubation of a sick child within the field ICU. So
Intubation.
I did it with my senior, and then I went back.
Okay.
Okay. And I did.
Okay.
I did study from AGPI article.
Okay. So, first of all, if you want to learn about any pediatric patient, what should be, but actually there is a lot of background sound coming. So if anyone else just answer this question, that if you want to learn this intubation of a sick child, okay, so how will you, like, what should be your learning goals? Intubation of a sick child. What things comes in your mind that what you should know? Anyone, please? Anyone other than Hisham, because there is a lot of background sound coming. Anyone else? Dr. Sarwan, Dr. Sajid, anyone, please? Don't be afraid. I'm not hitting anyone. No one wants to answer.
Assalamu alaikum.
Walaikum assalam. Yes.
Yes. First of all, if in our mind, if the sick patient is in our mind, so that means he could be septicemia and all these things. So he could be a hemodynamic unstable. So first you have to prepare. First you have to proceed from the IV accesses, like either he need a good IV access or the central line and the arterial line, non-invasive blood pressure monitoring, of course. Then see how much resuscitation he needs. Either he needs the fluids or he needs somewhat inotropes, because when you will proceed with some of the anesthetic agents, So definitely his blood pressure, the other things will be dropped. So
Further.
yeah, you have to be pre-operatively, you have to see all the things from the electrolytes, imbalances, fluids, anemia, and you have to optimize the patient before anesthetizing the sick patients.
Yes, actually,
that we have learned from.
Yes, yes, and I will just add on to it that actually the aim of today's discussion is to chalk out how to learn. There are so many ways, different ways of learning. So because that doctor said that I try to read through the case. Okay, so I just made an example of it, and actually my question was that what knowledge you should be having in your mind when you want to learn from this case. Okay, so yes, you're right that you will be looking the point in it that the condition of the baby. Okay, the condition of the baby, what is the reason for it, and what can be the possible causes of septicemia, and what will be the challenges if you will be intubating such patients. So this is one thing. The other thing will be the pediatric, altered anatomical, okay, physiological, pharmacological considerations. Okay, so if, for example, if you want to learn this case, you should be knowing about this thing. So one point will be, because you are dealing a sick child, so one thing is sick and one thing is child. So you should be knowing about why the child is sick and what are the things which are highlighted or selling points for a child. You should be knowing that there is a difference in anatomy, difference in physiology, difference in pharmacology. Okay, so you will have all the problems that you will have a challenging airway, you will have less functional reserve for resuscitation, or less physiological reserve for hypoxia, fixed cardiac output, less developed hemodynamic responses, baroreceptor reflexes, chemoreceptor reflexes. Patient can have very high vagal tone, sympathetic responses are not good. So these things come into your mind. Okay, similarly, liver is immature, kidneys are immature. So you will have to identify how much dose you want to give. Initial doses may be increase because of increased volume of distribution, and so these things you should be learning. So first point will be that you will be learning about this thing. So this will be one point. Other point will be causes and problems in a sick child, and third will be related to intubation. So what will be the different ways, what are the difficult airway algorithm in pediatric patient. Okay, so for example, if you are trying this case, you will be facing this case in the hospital, and if you are trying to read a page from Morgan, what will you understand? Will you be able to deal with this patient? I just asked to any Morgan lover or who tries to read from Morgan Sharif. Just tell me one thing, that how will you be able to? Do you want to speak out something, Dr. Fariha? Okay, so if you want to learn, you will have to identify the challenges of a specific case, and then you have to, can you mute yourself if you are not speaking, please? All my concentration is only going in just muting or unmuting. Okay, so you understand my point, Dr. Abdul Shakur, what I am trying to, Abdul Sami Abdul Shakur, do you understand?
Yes,
And
yes,
similarly,
yes, sir.
Similarly, who started this discussion? Hasham. Okay, so Hasham, next time, if you want to study, you will have to study in that way. Okay, and if you will open a book, any book, you will not find the answer. I can guarantee you. Until the time you don't realize that what are the challenges you will have in such patient, you will not be able to learn. And that is the problem, why there is a gap between you people and the exam. Otherwise, if you prepare like that, I can challenge you, examiner cannot fail you in the exam. I am using this word, examiner cannot fail you in the exam, because there is no person who is having any attraction or hater for your physical appearance. Okay, the examiners, even if they have something bad about you, they will not try to fail you. Okay, yes, maybe there will be a group of examiners who will be trying to pass you, and there will be some examiners who will not pass you if you are failing. Okay, so but there is no examiner who wants to fail you. This I can guarantee you anywhere in the world. Yes, the criteria will be difficult in different places, but the basic theme is that if you understand how to study, then it will be a no problem. But unfortunately, what you people are doing, you are cramming any book. 99.9% people in Pakistan, they are studying Morgan. Because why? They don't understand. When I have taken a survey, whosoever I ask, 99% people say, sir, we don't understand. But why the hell you are reading it? This is my simple question and nobody gives me the answer. Okay. And unfortunately, because I'm not able to have consensus among the supervisor, because the people who have passed the exam, they don't bother. They just finish the disc. They will not be running behind you, messaging you on, this is a weekend today in Saudi Arabia, and I'm giving you my personal time just for your betterment. But it's very easy to say, read Morgan, read problem oriented, and that's it. Guidance is finished, and you are so obliged. Our supervisor have helped us a lot. Okay. But unfortunately, they are, because if they will try to make you understand this point of view, they will have to invest some time. They will have to make you understand, because it's not so easy to start with. You will have to search a number of books. First of all, you will have to know what are your challenges. Like I told you that septicemia is one of them. There may be any, because Dr. Sami Abdul Shakur, you directly went to cardiovascular system. You can have airway, breathing, circulation. So your approach will be according to airway, breathing, and circulation. Your approach will be the septic child management. Okay. Of course, at the moment, the challenge for you is intubation, but actually right after intubation, you have to monitor a number of things like lactate level, fluid management, this one antibiotic, okay, clearing the source, and use of vasopressor and inotropes, central line, arterial line, as you told. And there will be a whole of the challenges which you will have. Even in the practical conduct of anesthesia, and even in the exam, they will not tell you that only we are asking you because you have read only from XYZ chapter or XY page of Morgan. So your vision is only on that page, and you are unfortunately unable to go to the next page, which not maybe the next page, maybe 100 pages after that. Into some points are written about sepsis. After 100 pages, some things are written about intubation. So how you will be able to coordinate till the time you don't prepare and use your brain in that way to start with? Even the residents, if they try to learn in that way, I can guarantee you again, you will never fail in any exam. I'm challenging you. But for that, initially, you will have to invest your time. Okay. So I hope you get my message. So otherwise, this is one way I have told you. Okay. So because in the exam, they are saying, sir, we have MCQs pattern, or we have some the people who are having still MS exam, they still have written exam. But I tell you something, the base is again the same. There are actually three things usually. There is one surgery, there is one patient, and there is one anesthesia. There is one surgery, there is one patient, and there is one anesthesia. So you have to apply in every scenario these things. Okay. So any surgery, if you think about surgery, this I have put it in the folder, I have made it, and you can have a look that any surgery, what is the surgical urgency? What is the surgical risk? What is the bleeding risk? What position patient will be in which position surgery will be done? Usual duration, level of anesthesia required, level of incision, because according to that you will have anesthesia options, analgesia options, and potential concerns and complication, and any specific age group which is having that surgery, or any critical step which will be occurring in that surgery. Okay. Any critical step. For example, I'm giving you an example that if you are having laparoscopic surgery, the insertion of trocar and pneumoperitoneum is a surgical critical step, which is us anesthetists should be knowing that they are putting the trocar. At the insertion of trocar, patient can have visceral injury, patient can have vascular injury, and patient can collapse within seconds. Okay. So if you don't know that this surgery has this critical step, similarly, if you have a patient for orthopedic surgery and they are putting the bone cement, this is a critical step. You should be knowing when they are putting the bone cement. There is a surgery for aortic surgery. vascular graft, this aneurysm, they are putting the clamp. So you should be knowing what will happen when they are putting the clamp, and what will happen when opening the clamp. Similarly, the surgery, surgery requires this incision or position. There are certain problems which are related to prone position or lateral position or Trendelenburg position or reverse Trendelenburg position or lithotomy position. You should be knowing. They will be only telling you TURP surgery, and you have to think that this surgery is occurring in lithotomy position. So what are the problems which can occur? Which can occur at the making of position, and which can occur during, and which can occur when they are reversing the position. Any position, the same rule will be applying. So in this folder, I have put a number of lists of a surgery, possibly whatever possible surgery I have put it. For juniors, they can have a look and they can prepare. Maybe there is a lot of repetition and there are a lot of things which are common, but I have just put it a list that these may be the surgeries for which you need to understand and you know. So first step is finished. The second step is, what are things related to the disease? Any disease you are reading, any disease. Just for an example, you name any disease. Anyone wants to discuss any disease, just common disease, just let me know. Anyone wants to speak about any disease? Abdul Sami, you can tell. Okay, I'm taking myself. For example, I'm taking diabetes mellitus. Sorry?
That's fine, sir. Like COPD patient, you are going
okay,
to discuss.
COPD. Oh, COPD we can take. So what is the category, pathology, and mechanism of problems? So COPD is a disease mainly related to lungs, but other systems, especially this one, heart will be involved in very short time. Okay, so main pathology is there is chronic inflammation, destruction of airway, and there is obstruction, which will be initially maybe reversible, or there will be some reversible component, but because of gradual period of time, there will be irreversibility. Either it is emphysema or either it is chronic bronchitis. Okay, so the main category it's an obstructive lungs disease. It is creating problem. It is leading to respiratory failure gradually. There is problem related to secretions. There is problem related to bronchospasm. There is problem related to hypoxia. And then gradually, if there is involvement of other system will also be coming. So main pathology is like that. Mechanism of problem, as I told you, there is too much secretions, there is sputum production, there is destruction of airways, there is either it is emphysema or chronic bronchitis. Usually there is a combination of it. If the patient is smoker or the patient has alpha-1 antitrypsin deficiency or anything like that, okay, you will be finding the answer gradually. But just make this frame in which you put any disease. Okay, you can put any disease in this mechanism. Like I told, diabetes mellitus, it's an endocrine problem. It's a metabolic problem. It has either deficiency or resistance to insulin. Okay, and then what will be the result? It will be anything related to metabolism will be affected. Not only fat metabolism, protein metabolism, carbohydrate metabolism, problems in everything will be going on. Okay, and then there will be some problems related to metabolism, and there will be some problem related to hyperglycemia. Okay, so patient will have problem in patient will develop neuropathies, patient will have autonomic neuropathy, sensory neuropathy, motor neuropathy, and then there will be microvascular and macrovascular complications which will be occurring. So you should be knowing what are microvascular complications, what are macrovascular complications, how these complications are evident. Okay, so if you fit, because usually this way is difficult to start with, because if you want to just have something preformed, just quick mix, and you just want to put it in the cup and eat it, I'm sorry, this is you may pass, you may find some notes, you may pass the exam, but remember one thing: when you will be in the operation theater as a consultant and you will have a patient, I guarantee you will have problem. And another thing is that morally, if you just imagine that your mother or your father or your brother or your sister is there, and you have an anesthetist who had studied in that way without concept, just guesses and cramming and without any concept, would you like your family member to be anesthetized by such a sample? You will never. So I don't think so you should be such an anesthetist who has passed the exam but don't know anything. Okay, so this is my humble request to all of you. Just think about it. Okay, and the best thing about is that if you just spend a few topics like that instead of just cramming the book, you make yourself, and I can guarantee you people are very intelligent. Not ordinary people become doctor, and not even super extraordinary people reach up to the level of post graduation. Not all the doctors are able to do post graduation, especially anesthesia. Anesthesia is a hell of a specialty. Okay, yes, we don't get respect from surgeons, but believe me, there is no specialty better than anesthesia or ICU, because the knowledge which you people have, there is no match to that thing. Okay, so it's a serious business. You are playing with the lives of human beings. Your mistake can lead to a fatal consequence. So, and it is very easy. Believe me, you just have to tune your mind open. You can have a printout and you can just fit it. Any disease you are reading from any book or any source, just try to find out the answer. Instead of just reading and reading, just try to find out the answer with reference to this possible thing. This is not an absolute, but you can have. Okay, so like the same thing, diagnosis of the disease. Like we have example of COPD, how that disease is diagnosed. There will be, for every disease, there will be some symptoms, there will be some signs, then you will be doing some investigations, and you will have some confirmatory test or hi-fi test. Okay, so initially what will be, there will be bronchospasm, there will be shortness of breath, you will be having, and then this may need to like you can have findings in ECG, you can finding in X-ray, you can have pulmonary function test, you can have flow volume loops, and you will be able to identify how much is the reversible component, how much is the severity of the disease, how much is FEV1, how much is the peak mid expiratory flow rate, how much patient is responding to the treatment in the form of bronchodilator therapy. So this, you will be, by this way, you will be able to, can you mute yourself, Dr. Anika? Your there is sound coming from your mic. So please, if you can mute yourself. Okay. So, so this is again, mainly any disease, you will be seeing what are the effects on airway, what are effects on cardiac system. Dr. Anika, can you mute yourself, please? It's a distraction for me, please. Hypothyroidism as well. Dr. Abdul Shakur, I have discussed every topic almost. I have discussed almost every topic. Maybe 1 week ago, I had a discussion for thyroid disease, hypothyroidism. So if you can just have a look on the YouTube, you will find it. Okay, I'm just trying to give you an idea how to study, okay, and how to use the resources. Okay, so there is a problem in airway. There is okay, and there is problem in cardiovascular system in the way that there is development because of chronic hypoxia. There is development of pulmonary hypertension. Okay, so patient will be having right heart failure because subsequently there is development of pulmonary hypertension. Okay, so similarly, if there is heart failure, there will be affecting on liver. How it is affecting the kidneys, because these patients are taking steroids. Okay, So there is steroids will have effect on all the systems. Patient will have involvement of, patients are taking diuretics as well. Diuretics themselves can cause problem. The patient might be taking for right heart failure or heart failure, they are taking ACE inhibitors. They can also affect kidneys, because whatever their disease is, one component is the disease pathology, and the other component is the treatment patient is taking, or any complication which may be occurring. So, and you all are lucky, the lucky thing is that all of us, we have a kidney, we have kidneys, we have lungs, we have heart, we have brain. Unfortunately, we don't use it all the time, but we all the things which we are talking about, you can put your hands on those things and you can just find out the problems in every disease. Just put your hand on that part and just think what are the effects. You will find some effects. Okay, so their bone marrow, these patients are taking steroids, so steroids have problem with the bones. Bone marrow not necessarily, but there is some medications which they are taking, there may be effect on bone marrow in some way or other way. Okay, there will be problem in acid base balance, electrolyte imbalance if these patients are taking chronic beta 2 agonist. So beta 2 agonist can cause hypokalemia. Okay, they are taking steroids, there will be fluid overload. Okay, there may be like the things related to the not only main pathology, because of the medications the patients are taking. Okay, so this is how you will be evaluating any disease on it, because we are just having COPD in our mind, and then looking for the optimization or targeting reversible components of the disease, and estimating the cardiac risk, pulmonary risk, renal risk, aspiration risk, PONV risk, airway management risk. Special monitoring needed, blood transfusion needed. Just try to fit COPD in it. What you can do? You can have beta 2 agonist. You can have anticholinergics. You can have antibiotics. You can have mucolators. You can have treatment of heart failure. You can have treatment of pleural effusion. Maybe you need pleural tap. Okay, you can have incentive spirometry. You can have postural drainage, physiotherapy. In all the ways, all these things which I have told you, you will achieve some optimization of these patients before surgery. Yes, not last but not the least, smoking. If you have the smoking cessation, the COPD patient will improve. Okay, the carbon monoxide level will decrease, nicotine will decrease, there will be some improvement in the respiratory function as well, mucociliary function, bronchospasm, and things like that. Okay. And in this patient, there are cardiac risk. This patient is at more risk of heart failure and ischemia and everything. Similarly, pulmonary risk. This patient is at risk of post-operative respiratory problems, bronchospasm, pulmonary edema, and atelectasis, pneumonia, failure. Okay, so this patient is at risk. Similar renal risk. If these patients are taking for any reason, not only this patient, but you will find not everything in every patient, but a number of things in different patients. Okay, so this patient will have problem in airway management in the way that maybe this patient can become hypoxic very easily. This patient, if you are ventilating, this patient can develop pneumothorax. Okay, you will have more problems in high airway pressures. You need to have more prolonged expiratory time. You may have problem in ventilation. So things like that, you will find out. In special monitoring needed, might be this patient needs intra-arterial blood pressure monitoring, CVP, airway pressures monitoring. Okay, post-operative HDU, ICU, post-operative monitoring will be needed. Okay, so similarly, like I'm just giving you an example, and I'm just trying to make your brain work for every disease. There will be 100 disease, 100 common disease. Just practice one by one in that way, rather than just cramming the book. You will find the answers, but maybe when you are reading, don't appreciate, and you are not able to answer when it's being asked, because you are just reading prospectively, and maybe you don't remember. But if you are reading in retrospective way, that these are just, maybe someone can improve this list. This I have just made it myself. There is room of margin, the room of improvement. Okay, there is always margin for improvement. So you can improve it. You can make your own, but the way should be like that. Okay. So similarly, long-term complications or problems, effects of medications or side effects. Okay. And then when you are thinking about the conduct of anesthesia, as I told you, fluid therapy, recovery, post-op care for every patient, muscle relaxant. You will be avoiding in COPD patient. You will be avoiding any medication which is causing histamine release. If the patient is already taking beta-2 agonists, maybe this patient is already tachycardic, so you don't want the heart to have more tachycardia, so you will avoid pancuronium. So similar like that, you will find a number of, so cisatracunium will be a good choice. Like rocuronium you can give, because if you have any problem, you can reverse with Sugammadex. So things like that, you will make up your own. So analgesia, this patient should have very good analgesia, especially if the patient has upper abdominal surgery. Otherwise, patient will have pain, patient will have splinting, patient will have not breath holding, and patient will not be able to breathe, and there will be even further chances of atelectasis, infection, and respiratory failure, precipitation of respiratory failure. Similarly, you might need to have a baseline ABGs just to have that level maintained, because if you wash out CO2, patient will not breathe. If you give too much oxygen, the hypoxic drive will be lost and patient will go in respiratory failure postoperatively. So these are the things which you can chalk out for every disease. Okay. So on the basis of history, examination, investigation, you have a risk assessment and stratification, how much you can optimize and how much time. Time will be told by the urgency of the surgery. Okay. If the surgery is urgent, you don't have time. You can only do the things which you have, which you will give, for which you have some time. Okay. So optimization of the medical condition, as I told you, anticipation of complication, planning of all anesthesia steps. As I told you, these are the anesthesia steps. Wherever you are, whether you're in Pakistan, Saudi Arabia, South Africa, or Africa, these are the anesthesia steps. They are never changed. Every patient need to have induction agent. So you will not use, you will avoid thiopentone, propofol, because it blunts the airway. So it will have a better response with reference to respiratory system. Similarly, you will find a number of things accordingly. I cannot tell you each and everything in this discussion, because I'm just trying to give you an overview of how to study. Okay, so maintaining homeostatic condition, like you will have good, I label them as my best friend. Okay, so just I will show you what are those my best friends. So these are my best friend: normoxia, normocarbia, normotension, normovolemia, avoid sympathetic stimulation and stress response, maintain myocardial oxygen demand supply ratio, maintain sinus rhythm, maintain SVR, maintain preload and afterload, maintain rights and left-sided cardiac filling pressures, multimodal analgesia with paracetamol, NSAIDs, opioids, regional, local anesthetic, gabapentin, ketamine, nitrous oxide, IV lidocaine, dexmedetomidine. I have not written here, but these are the things which you can use it in a proper way and you will have a good answer. So this is the step number 2, that try to understand how a disease should be read. So I request you, just make a list of the diseases and then try to fill with reference to all these steps. Okay. So the other thing which you are doing is MCQs books. Okay. So if you just go to this folder, MCQs world, and I have arranged different sort of MCQs books in folders. So you can go to any book. Okay. These are all alike. There is no specific book you are required, because the problem is that in your mentality, in your brain, it is being it is fed that you have to try and look for the book which is recommended for MS, which is recommended for MCPS, which is recommended for FCPS, which is recommended for MD, which is recommended for FRCA, which is recommended for IMM. I don't understand that why don't people don't understand that all these exams related to anesthesia. So believe me, thyroid gland is in the neck and secreting thyroid hormones and being controlled by pituitary and hypothalamus, whether you are appearing in IMM, whether you are appearing in FCPS, whether you are appearing in FRCA. It does not change, and it does not start secreting aldosterone for FRCA exam. Okay. So if it does not change, how the books can be changed? Just answer me this thing. Ketamine does not depress airway or does not depress cardiovascular system in FCPS, in FRCA. So how it will be changed? Because your approach is negative. Your approach is wrong. You people are misleaded and distracted by wrong thoughts. So unfortunately, you are not able to decide what you should read and what you shouldn't. Rather, you should be knowing the topics. You should be, and then next question which I received, sir, from where we will get the topics? And I just wish to hit my head. Just think, these are the topics. Just think, open any book and you will find the topics. Topics written everywhere. The only problem is that not every book is having the same approach as I'm telling you. Until the time you don't have that approach, you will not be able to cover the topic in a full way. Maybe you can pass, or maybe the people who say that, sir, we have only read Morgan and we passed the exam. Actually, they people are extraordinary, or they are lying. I myself was a mediocre student, and I am talking to a mediocre student. I'm not talking to extraordinary people who can grab the things which are dispersed in any book like Morgan. Okay, so this is my request. Try to understand. Try to understand. If you understand, it will be very easy. Like, for example, I will highly suggest you, whatever you exam you are going for, these books are excellent, because in Pakistan we have choose the best. So people open the book and close it because, sir, this is our pattern is, sir, different, sir. So why should do true false, sir? The thing is that if you know, if you open these books and make the points, PK of ketamine is etc. Patient this ketamine has this isomerism, this effect on respiratory system, cardiovascular system. The question, whatever question is coming to you in even in choose the best, will be from some of these points. And if you have the knowledge, I can guarantee you will be able to answer. So the aim of reading these books is not to have possible questions in the exam. This is for the possible points which may be asked in the exam. So if you just try to have, and I will suggest you people that try it, because maybe you will find it a different way, but I will suggest you, all of you have smartphones. So I will suggest you, whatever topic you are reading, whether from any book, MCQ, whatever, the points which you find, just try to record in a audio file and save it with the day. Like I can have that ketamine is phencyclidine derivative. It is being used for induction, but it's an excellent analgesic. It for resistant asthma, or when all the first line drugs are being used, it can be used for asthma as well. It causes dissociative anesthesia, and there are drawbacks because it causes delirium. It is NMDA receptor antagonist, and it is competitive antagonist of glutamate. It also has local anesthetic properties, and it has two isomers, R and S. It has one chiral center, 7.5 is PK. It is highly lipid soluble and 10 times more than thiopentone. Okay, and S isomer is more potent. So if you just record it, maybe in 30 to 40 seconds, you will be able to record the points which you extracted from this book. Okay, and then you can just put in day wise. You will have a next day when you are in operation theater, you can listen to the recording. And I can guarantee you, if you make points like that, I can bet on it, because when you speak out, a lot of things you will clarify. Okay, so this is my suggestion. Read these books like that. Don't try to cram like that. Just try to extract the points like I extracted. Okay, so this is the way you can revise later on, but you will have to keep it saved, and there is no explanation or excuse in 2022 that I don't know how to use smartphone. This is not an explanation, because if you will try to use it by writing, you will have to take more time. Of course, you can write as well, but writing will take more time, recording will take less time, and recording is more effective. So my suggestion is that at least read 1 or 2 books, because these are the books for primary FRCA, for people who are going for European diploma in anesthesia, even the people who are going for Pakistan DA exam, they are from basic sciences. So if you can make your concept from that, these books. Okay. So these are all books for basic sciences. Okay. You can choose any one of them. This is actually similarly book, which is anesthesia comprehensive. The similar book is for clinical anesthesia as well. So actually this book is very good. If you have a look at it, you will find a lot of knowledge in this book. Okay. But of course the way will be like that, as I told you. Okay. Try to make points. It's not important that what is the answer. It's not important, because this question will not come. So even if you understand the knowledge in this MCQ, so if you just find the answer of any specific MCQ, it will be useless, because the thing is that the same question is least likely to come. Okay. So you have to understand what was the knowledge in it, because if you have the knowledge, if any question similar to that will come, you will be able to answer. But if, for example, if you just try to cram the answer, because people are only looking for the queen, they are only interested to know what is the answer, sir. Sir, what is the answer? The thing which is going on throughout the day in the group, I don't like. I want you people to understand the question rather than A for apple, B for ball, C for cat. But what is going on? I'm sorry, I cannot, because that's not what my aim is. I want you people to understand that question.
Hello.
Because, sorry. Okay. So similarly, you can use this folder for clinical sciences MCQs. These are all number of books you have already. All these books are same, but don't try to read these books in a way that you are trying to cram the answers. Try to understand the question and just try to extract the knowledge. Okay. And similarly, remember one thing, that there are some questions in these books, especially, which are created according to a specific study. That study may be different than written in the books. So in that way, you will have a totally different answer in your mind according to your concept. So don't be distracted from that MCQ, because it's not necessary that such question will come to your exam. Okay. Just try to have a basic concept. Like I give you an example. There is a confidential inquiry into maternal and child health. They are asking a question about the maternal mortality. Okay. Or maternal morbidity. This is different every 4 years. Maybe sometimes maternal hemorrhage is at the top. Maybe sometimes PIH is at the top. So maybe you change it. And there is another difference. These all books are British books. Okay. And this Morgan is American book. So there are certain MCQs books which are put here. This one, best choice MCQs. These are, majority of them they are American books. So you will find different questions and different answers in this. I have put all American books here. Okay. So a number of these have some old editions as well. I'm unable to arrange them in a very nice way. I have myself made it. No, I don't get any help from anyone. Whosoever passed the exam, just leave the place. Okay. So, but anyways, so this is another thing which you should be knowing. There are some regional anesthesia I always recommend and I always advise you to read. At least this book is excellent. Okay. And there are, except for only one thing you need to exclude, because in this book, you will find for each block a number of approaches. Like for sciatic book, they have written 4 approaches. You don't need to know all the approaches. Okay. But other than, if you exclude only that part, otherwise this book is excellent. And I highly recommend you people to read it, because it has a lot of knowledge which is being come in the exams. It has information about ultrasound. It has information about neuromuscular blockers. It has information about the highlighted peculiar points of
Sir, I have a question.
Yes, please.
Sir, like certain book को like how much time to give? एक month में एक book करें.
Dr.
time
Hira,
management.
Dr. Hira, we have some international speakers, so if you can ask the question in English. Okay.
Yes,
And
yes,
another,
sure.
I can understand your
yes.
question. I will try to answer. This is actually a question which is being asked in high grades, high school, or medical college. Up to medical college, this question is valid. But this question is not valid in professional, with all people having a family life. Every person has different scenarios, so nobody can tell you that. I cannot tell you, maybe you can finish in 1 week and I can finish in 1 day, or maybe you can finish in 1 day and I can finish in 1 week. So there is no question about it. And the good thing about anesthesia is that, believe me, anesthesia has very little anesthesia to read. Anesthesia has very little anesthesia to read. You people, all people, if you think this has anatomy, physiology, pharmacology, pathology, medicine, you name anything which is not there, except for maybe dermatology or psychiatry. Maybe everything else is there in the anesthesia. So if you just tune yourself, trust your knowledge, trust your brains, come out of the spell which is created or thrown away in your minds, that paper comes from Morgan. You have to read Morgan. First reading will not give you any concept, but you have to keep on torturing yourself. Maybe after 10 readings, you will be understanding few points. What the hell is going on with our residents, and what sort of crime our supervisors are doing? I'm really sorry to say. So whosoever is asking you to read only a tunnel vision book, I'm sorry, that person is not your friend. You use your own brain. I don't trust me. Don't trust me. Don't follow me. Just try to understand which is correct thing and which is wrong thing. There is no shortcut to glory. You will have to
Sir,
work
do
hard.
you have problem-oriented book for FCBS, like
No
before
book.
Viva, for theory?
Remember one thing. Problem oriented is even worse pathology. If Morgan is benign pathology, problem oriented is even malignant pathology. You will not recall. You will not be able to understand. There are so many extra things which are useless, are written in that book.
Okay.
So make your points. Remember one thing. They will be asking you. I give you an example, because I have read almost all these books, Morgan and problem oriented and Stalting. I have read a lot of stuff. But I tell you something. When I was being asked about anemia, or sickle cell disease, I tell you something. In that sickle cell disease, even they have written about acute chest syndrome, and they have written the sign and symptoms of acute chest syndrome which occurs in sickle cell crisis. Will you be able to tell them and in the exam? I can guarantee you will not be able to. But so why you are wasting your time? Nobody will fail you. What are the signs and symptoms of acute chest syndrome? You will not be able to identify, because there will be a little bit difference. So you cannot recall problem oriented. I can guarantee you. So right now, I just challenge that. I asked this question for sickle cell disease. They are telling me there is a problem in valine and glutamate, and they don't tell me in their definition that it says it's an anemia. They forget this thing. The sickle cell disease is an anemia. Whatever is going on, there is a problem, there is disorder, there is a problem in amino acid. And at the end of the day, because whatever is not written in the book, you will not be able to tell till the time you don't understand the concept. Okay. My request is that you understand the concept. Okay. So because I am getting late, I will just tell you a few more things before I finish. So MCQs, regarding MCQs, you should be reading like that. These are review books. So this will give you a lot of knowledge, and you can use them. Like, for example, this book, if I suggest you can read according to the cases, and you will find a lot of knowledge, and then you can add on to whatever you have read from your book. Okay. You in one case scenario, you will find, or you will revise a lot of things. 70 years old male. Think about a 70-year-old male. What are the physiological, pharmacological, anatomical considerations in an elderly patient? So you have an elderly patient. Then this is for an abdominal aortic aneurysm surgery. So think about what are the causes of abdominal aortic aneurysm. What are the problems? As I told you that there will be clamping, cross clamping. So you should be knowing how to tackle clamping, how to tackle unclamping. What are the problems how to have renal protection, how to have spinal cord protection, how to control the blood pressure, how to have the use of vasodilators and vasopressors in that surgery. Okay. So similarly, then you will have this hypertension. This is actually making your brain active. This will give you a lot of knowledge like that. Hypertension, ischemic heart disease. So medication, what is the mechanism of action of simvastatin? What are the side effects of simvastatin? What are anesthetic consideration of simvastatin? These three questions you can ask yourself whenever you are reading any. What is the mechanism of action? What is the anesthetic consideration? What is the systemic involvement commonly? So simvastatin, the problem will be related to raised liver enzymes. So simvastatin can have liver enzymes raised. It can cause liver dysfunction. So this is one thing you should be knowing. So you will be avoiding any other medication which can further has some problems in the liver enzymes. Okay, or the medications which are metabolized by the liver, you will be using with caution. So things like that. Similarly, enalapril can have hyperkalemia. The dry cough, patient can have renal failure. Okay, so you should be knowing what are the things related to enalapril. Similarly, atenolol. Similarly, you will be keep on reading and you will keep on having the questions to find the answers. So if you will read like that, because I will have to finish, I have to go for prayer. So I will tell you that this is the way to study. I wish to discuss these things with you, and then you can make small points to read further. Okay. So
Sir, can
similarly,
we find this class on YouTube after it ends?
yes, of course. That's what I'm trying to say, that I'm really thankful to you, Hira, that you have finally joined it. I'm sending this request to daily to people, and people don't know. People don't attend because they think that it is something which is coming. I don't know for what purpose this is coming. All the recordings which I had started this thing last year, and almost all the topics are being covered. And because for people in Pakistan, I need to explain this thing loud and clear that I don't have any financial interest. Okay, this is for all of you. These discussions are all in English. You can see the playlist, and I will highly suggest you people preoperative risk assessment. This is very important. Okay, then I have a folder here which is for how to study. Just a second. Okay, so I will put this in this folder, how to study. You will find it here. Okay, so everything is being discussed a number of times. Maybe yes, a lot of topics still need to be discussed, like basic sciences. I'm for that topics I need to study myself and I have to prepare. Otherwise, it's not. But I have in my mind, because a number of times they're asking for anesthesia machine, for breathing circuits. So in near future, I am trying to do it. So, but the thing is that I'm discouraged by the people, because usually I'm taking daily classes, but unfortunately none of you comes. Anyways, you will find it. So this is for regarding this clinical. And one more thing I will tell you, because these days SAQs are not coming. So you people have totally left these books, but I will request you, even if you don't have SAQs pattern, please have a look. And if the people who are appearing in the British exams or Irish exams, CRQs are there. So CRQs is constructive response questions. So have a look on these books. I have not read this book because this is a newer pattern, which was not there when I appeared in the exam. But it will give you a big practice for pinpoint knowledge, because they will be asking you a very small thing. It is not like SAQs. Okay, it is pinpoint small. What will be the next step? What are the 3 causes for this thing? Things like that. Okay, just you can have a whole look here. Okay. Okay, so what is this? Just primary gravida, postpartum neurological deficit suspected, 24 hours delivery, forceps delivery. List 2 obstetric features which are commonly associated with postpartum neurological deficits. So things like that. Okay, so you will find the answers, and then you can read somewhat more detail.
Sorry for interruption. Actually, the problem is when we begin to study, we really don't know where to start. And then we actually realize we should go back to first year and second year and open the books of physiology, Guyton, and
no. This is not. this is wrong. Hera, this is totally wrong. You people have to be objective. There is no basic sciences for basic sciences in our exam. Whatever basic sciences they are asking, this is related to the clinical science. But for example, if you are reading hypertension and you don't know how to have control of blood pressure, can you answer hypertension physiology, which is being asked in the long case of FCPS? You will not be able to. Okay, even if you don't know what is the mechanism of control of blood pressure, you cannot learn about antihypertensive medications, because if you know it, that there is problem related to stroke volume and there is problem related to, thing is that you just have to understand, my dear. The thing is that problem is that if you will be trying to find out a paki pakai kheer, there is no paki pakai kheer, believe me. There is no paki pakai kheer. There is no preformed ready-made food for you. You will have to make your food. Okay. So you can start from any book. I can guarantee you. You can start with any book. Let me show you one more thing. You see, this is topic-wise questions folder. Okay. And here I have put these folders, which I have told you. You can start. This is not a ultimate, but you can use this. This is 150 topics. I have just made like just to make it attractive for you people. You can start with it, and then later on, any topic which is missed, you can add on. Okay, so this is one way. And this anesthesia plan and journal plan, all of them are here. You can have a look here. There I have discussed about testing, preoperative testing, different questions being asked in the history.
Sir, I have a question. When it comes to articles and tutorials, so we do not know whether to follow FRC or ATOTW. Are they different? Which one to go for?
No. Again, don't go for the titles. To see what is written in it. If it you are able to understand from ATO2W, you go for ATO-TW. There is no difference. These are different. One is Khadi and one is JJ. So maybe you will find something good in some style good in JJ and some style good in Khadi. Both are good. Okay, there is no difference. You go to the topic. You go to the topic and then you will find which you will like. For example, if you go here and you go to this gynae ops, because gynae ops is a dynamic topic, so you will find too much articles about it. But if you go in details, this you see, you will find, for example, this cardiac disease. So, for example, peripartum cardiomyopathy is there or is not written in FRC, this one BGA education or the another source which I have. It's not written there. Okay, so you will find this topic only here. But for other topic, maybe for example, this hypertensive disease PIH, you will find 2-3 articles. Okay, so you can just have a look on one of them and then compare with the other. And usually, you will find the objectives, you will find the headings, you will find it's such a compactly covered material that I can guarantee you that if you just break this idol or break this concept that there is some textbook or there is some baseline knowledge, the base book, you will find a very beautiful world outside. Okay, so first of all, if you want to learn about gynae ops, try to see what are the things which may be asked from gynae ops. Make a list, make questions, and then find out the answers. I can guarantee you that you can do it. It's not difficult. It's only because this is a myth that you have to follow a book. Unfortunately, you are just hurting yourself. Okay, so if you have a number of articles from the same topic, you can choose any one of them. Like this is 2014, this is 2020, but some of the things are better written here. Okay, ATOW is usually relatively easier. Okay, this is much more easy than BJ education, but sometimes you will find it better in BJ education. Okay, so just try to have because pathology never changed. Even if this article were published in 2000, pathophysiology never changes for UL diseases. Okay, anatomy, physiology, pharmacology, usually the basic concepts never change. Only newer medications come, newer trends come, some guidelines are changed frequently. Sepsis guidelines you have to follow from the latest one. You cannot rely old one. But the sepsis pathology will remain always like that. Similarly, ARDS will remain like that forever. Yes, ARDS management guidelines are changed. ARDS diagnostic criteria has changed, but the main ARDS will never will not change. Okay. So this is how you have to approach your studies. All the topics are being arranged. Okay. And this is the link in which I have put it year wise. I share this link daily, believe me. This is just a second, this one. Okay. So because the thing is that recently I'm unable to arrange year wise into topic wise. So a number of topics, like you see, this is 2022 and you will find up to September. Okay. This I am not able to put these articles to the relative topics. So I didn't get the time to put them because it's really difficult for me to take which on which topic it should be going. So it's a tiresome job and I'm unable to do it, but you can do it for yourself. Okay. So this is BJ education articles. This is ATO2W. Okay. Up to 2022, all some may be missing later on. And this is
Sir,
another
BGA,
source.
FRCA are same. BGA and FRC are same.
There is no article for FRC. The BJ education is for recommended source for.
There are articles on frc.org.uk. So I'm asking about that.
I don't know which you are talking about. You can share with me. I will have a look. But this BJ education, it was before its name was CEA-CCP, Continued Education in Anesthesia, Critical Care and Pain. Okay. This is, you see, since their birth, I have put all articles year wise. It's, but alhamdulillah, nobody is having any time to have a look. Okay. Because you think it is for myself. I don't have to appear in any exam. Okay. And this is another source. This is excellent source. Okay. And I couldn't renew the subscription. Okay. But this is, I don't know the exactly name of this source. Just a second, let me show you. Core critical content for postgraduate anesthesia training and content. This is excellent. Okay. This is, its name is Elsevier Anesthesia and Intensive Care Medicine. Okay. So I had purchased these articles for you people. Okay. This is, their way is very good. A number of topics which are not being covered in ATO2W and BJ education are here. Okay. And their way is very easy. You don't need to cram each and every line. You just have to have the extract. Okay. And that extract will be sufficient for you. Okay. So this is a different world for all of you. But this world is much, much, much beautiful than the world which is being created for you people by manhoos, terrible, pathetic, crap Morgan. Yes, Dr. Qurban.
Sir, how are you? Fine. I want to ask you a question. Can you please share the link for the Google Drives, as we want to learn something from there?
Yes. Are you in anesthesia knowledge group?
No, sir. I just joined you today, and I am very impressed by your way of talking. And where I did my training from the Lahore General Hospital in Pakistan, and I find this very wonderful knowledge.
Okay, just a second. If you are not in anesthesia knowledge group, from where did you get the link for the joining? Did you find it from YouTube, from Facebook?
No, it's from my some of my friend. He is doing a MCPS. I did my training in anesthesia from the Lahore General Hospital as a DA student, and nowadays I am working in a Tehsil headquarter Hospital Faisalabad.
No, Dr. Qurban. No, Dr. Qurban, I have sent you my number. Please note it down before I finish the class. Note it down and send a message. Okay.
Okay, sir. Okay.
Send a message on WhatsApp. Okay. Because I send this link daily. The message which I send to you daily, there is link for articles. There is link for this books. There is link for YouTube playlist. Okay.
I will be thankful to you. I'm thankful to you, sir.
Just message me. Note down. Have you note down the number? So you can just message me and I will answer to you. So, okay, Hira
Thank you,
and
sir.
all of you, thanks a lot for your presence. All my discussions which are there in the YouTube, the basic theme is, my dear, this one, because I'm not giving you any notes. I'm not giving because you people, unfortunately, because you are being fed that you cannot use your intelligence. You are bound to listen to the people around you. This is the problem. You have switched off your intelligence and thrown in the dustbin, and you are not using your brain. You are just trying to follow the herd. Just like what we say, bhed chal. Bhed chal is a terrible thing because we are only looking at the others. We are only relying on the push from the backside, and we are pushing. We are without knowing where we are heading, and that is the reason we fail in the exam. And unfortunately, I am saying it loud and clear. There is a lot of resistance. There is a lot of grudge for me that I am highlighting this thing again and again. But I don't have any fear. I don't have any regret. Majority of our supervisors are not doing their responsibility. And I'm really sorry because I have no personal conflict of interest. I'm not in Pakistani system. I don't have to compete with them for becoming supervisor or professor, or I don't have any financial or and by the way, all of my respectable to me. I have no personal grudge with them, but I have serious grudge from their approach. They are sitting in the OR. They are sitting in the offices. They don't come to the OR. They don't come to see you what you are doing in the operation theater. They don't follow you. They don't ask you. And you people are responsible because you are only of running away from work, running away from studies. And you are just relying that at the end of 4 years, we will just have some XYZ notes and we will pass the exam, sir. Sir, we have to do double job, sir. We have family, we have children. Remember one thing. I was a terrible private practitioner and I suffered a lot. And the as much I would have earned in 1 year after passing FCPS, I had not earned in 4 years of terrible private practice. Because if I had passed my exam early in time, maybe even in 4 years, I could not earn that as much I could have earned if I have passed the exam properly in proper time. But believe me, I become short of breath while talking to you people, and I'm so disappointed that nobody listens, nobody respond. Majority people, they don't even know there are, sir, where is that folder, sir? And I don't have any ego. Believe me, whosoever contacts me, I reply. I reply. I have no conflict of interest. But I'm requesting you, please ask your supervisors. Don't be afraid of them. Make sure they are asking questions to you. They are not sitting in the offices. Make them come inside the operation room. This is no way. It's not. They are enjoying TACA. They are enjoying a position. They don't become supervisor for enjoying this position. Only to have flirt with the girls and crush the men, the boys. Is it for that thing they are becoming supervisor? Only to have photographs, cake cutting ceremonies, big conferences, seminars, working in COVID warriors. Unfortunately, the height of depth of the moral values which are there everywhere in our country, you will see in that unfortunately our system as well. And I'm only doing it, believe me, just to that when I go to Allah, I will be saying that I tried myself. I tried my level best, because when I tell them to do that, sir, they only say to me, you are not in Pakistan. You are bloody overseas Pakistani. You don't have any right. Come and serve here. Okay. So I just say honestly and loud and clear, I don't want to be like you. That's why I divorced not 3 times, 4 times, and I pray to Allah that Allah don't let me go to Pakistan again. Because because not because I don't like or love, I don't love Pakistan, but the system there is pathetic. Because there are idols, and because why they are idols? Because you people worship them. You people are afraid of them. You people don't ask questions to them. You people, when they tell only read Morgan, Why don't you ask them, sir, we don't understand from organ. Sir, what are the pearls in that topic? Sir, please tell what are the questions which are being asked from thyroid. Read them and go again, ask, you see, because the thing is that in our system, supervisors are unapproachable. They think they are, they have a special, they have to do so many things. So the basic thing which they are supposed to, they don't do. I'm not talking about exceptions. There are very good people like Dr. Liaquat, and there are so many people who are dedicated people. There are so many people working, but they are nothing as compared to majority. And I'm talking about majority. I'm talking about people who are doing training in Nawabshah. I'm thinking about people who are doing training in Quetta. Okay, the people who are doing training in pediatric hospital. What the hell? How can you do FCPS training in cardiac hospital, in pediatric hospital, in kidney hospital, FCPS anesthesia training? Who have recognized them? With which mentality they have recognized such institutes for training? It's totally unfair to them, believe me. And please, whosoever is listening to me, don't take me wrong, because I listen to this opposition, so I don't care. I don't mind. They can say anything about me. I don't have anything bad. But thing is that if you people will change your way of behavior, because you people don't ask questions to them. You people are running away from them because you have fear they will kill you. But remember, that embarrassment which you will face in operation theater 1 or 2 times or 10 times is much less than the embarrassment you will have when you will not pass the exam, when whole of your family will be suffering and you will have terrible life like I had to for 2 years. I had to take beta blockers because I was failing 1 time, 2 times, 3 times. I passed the written in 3rd attempt, and last attempt I passed the viva. So I know what is the meaning of failures. Okay. So
the problem is that the material that is present here, it's
yes,
terrific, it's fantastic, it's like a good compilation. But again, I would say it would be like for an R4, it is so difficult to do all this
no.
in 1 year.
Remember, Hira,
Somebody
I tell
who
you
is asked
something.
to do this.
No problem. I
Yes.
tell you something. It's not matter of R1 or R2 or R3 or R4. You don't have to. Why are you worried that you need to read each and every line of it? For example, you just take topic by topic. Okay. You go topic by topic, and then you will understand that certain topics you need to stress more. Okay. And certain topics, for example, if you know about TURP, you don't need to read each and everything. You see, I have just put separate thing, like this question is being asked a number of times, how to avoid the obturated jerk during TURBT. Okay. So similarly, only you will have fine tuning. It is just to make your knowledge organized. These articles will give you organized knowledge. You will be knowing, like we started from where we started, intubation.
But some people have an intelligence to guess what more has to be emphasized, and some do not have. Some, it's
when
very
I
difficult to
discuss,
find out what to press.
Hira, for that thing I am there.
Because again, it comes on the duty of the supervisor when anything is not being discussed with you, so you do not know what to emphasize.
So you have to make them work. Okay. So you have to run behind them, be beastie proof, free of all whatever he's saying to you, but make sure he is with you. Okay. If he is only running to do private cases, if he is only running to have cake cutting ceremonies, is only there to have pictures and put on Facebook, this is not his duty, my dear. This is not his duty. You have to make them work. I'm trying my level best. I'm in the WhatsApp group. I'm sending messages to them. I am just trying. I'm listening a lot of resistance, but I don't care. Okay, I don't care because I'm doing it. I'm facing this resistance for you people. Okay. And you are saying that you cannot understand. I can guarantee you, because thing is that it's still there is a belief in you, in yourself, that I cannot do it. So if you will be there with that mindset, unfortunately, you maybe not do it. But if you trust your knowledge and if you trust yourself, you just have to extract. Okay, you just have to extract, and it will take some time, and it is better than failures. The people who are the juniors who are listening, if they make their way of studies like that, I can bet on you. And I'm there. I respond to each and every message. But if you don't message, what can I do? Despite everything, because I have made it a passion and a challenge. Okay. So if you don't understand anything, I am there. Yes, the question which I don't like, sir, where in the folder this is there? Please, for a woman, as much as time you spend on cupboard to find out dress for the party, I can guarantee you, if you spend that much time to have a look on the folder, you will understand where are the different things. This is FRCA mind maps. Excellent. You just search, and after some time you will know this is in FRCA mind map. These things are there. These are topic wise questions. A lot of questions are there. Just have a look. How much time it will take, my dear? It will not take much of the time. I have not made a number of questions myself for last many months since I have started this discussing on Zoom. I'm unable to get the time, but whatever folders, whatever files are there, I have made myself. Okay, so just spend some time, and if you don't understand, I'm there to help you. Start listening these recordings, and if you don't understand anything, just drop a message in this file in this minute. What you are saying, I don't understand. I reply to them. I reply to whosoever is asking me. I am replying to them. The people ask about international exams. I had discussed about career counseling. Okay, you will find a number of things I am trying to do it as much as possible. Okay, so thank you very much. Inshallah, I hope it will give you some way how to study. Okay, and I'm there always. Okay. Yes, it is unrealistic. You are absolutely right that it is unrealistic, because they think that nobody can ask them. Okay, but it is not unrealistic. I can guarantee you that if you start asking and taking interest, I'm not blaming them always, but thing is that both of you are to be blamed. The supervisor, they don't take interest, and they say resident don't work hard. And I ask them, will you leave your children? No. So for the supervisors, these residents should be there like their children. They are responsible for them. Okay. So the thing is that that's what I'm saying, that some people mind my word, but my words are sincere. This is not for myself. This is not to humiliate them. This is to humiliate the system. This is to humiliate the system, and this is your fault that you people don't ask. But this is still, supervisors should be taking pain for the failure, or they should be responsible. They should be responsible because they have taken the responsibility that I will train. If they cannot train, they should leave. They should leave the supervisorship. The people who are on training position, they are on teaching position, they are enjoying a lot of prestige. So this is the payback for their prestige. They cannot say that, we are doing a lot, so resident don't listen. Okay, so this is we can challenge, my dear Umar. Please don't be afraid. If you, I'm not, listen, this is just to ignite yourself. I'm just trying to make sure that you people think that you can do a lot of things instead of being failed and then hurting yourself, hurting your career, hurting your family. Because if you have financial problems, these financial problems will be more if you are passing the exam late rather than in correct time. Okay. Yes, Dr. Qurban, you were asking something.
Thank you so much, sir. Sir, I don't have any link of your Google Drive. Can you please share with me? Thank you so much.
No, you have you sent me message on WhatsApp?
Yes, sir. Yes, I sent.
Okay, I will reply to you. Don't worry. I will reply to you.
Thank you.
And Dr. Umar, can you just speak out, please? Because I want to answer your point. They will destroy someone's career. No, they cannot. Don't be afraid of them. Don't be afraid of them, my dear. If you are diplomatic, I'm not asking you to have a hammer and hit your supervisor. I'm only asking that get him involved. Ask questions. Ask him to teach you. How can he damage your career? Just tell me. He cannot. Trust Allah.
Sorry to bother. Yeah, just sorry to bother you, sir, in between, actually.
Yes.
Most of the trains in our Pakistan, the people, who they are supervisor, they are only for just for fun and all these things. And once you will raise your voice once, twice, that's true. And they can have you have some personal issues with them. I'm just talking about 2008, when I was training for the MCPS. On those days, I can recall, I was living in Karachi. One of our head of department, I will not call the name of the hospital, but there was epidural was only for the game of the few years. They were just going to start in 2011. So what he was doing, he has a separate room, and he was taking the patient downstairs to put the epidural, to avoid the other things, to learn this one. So other juniors and fellows. So because of he has a good private practice at that time. So this kind of people's mentality is there. So how you can change this?
No problem. No, Abdul Sami, you can only do what is in your hand. Again, I tell you, you don't have to be arrogant in front of them. You don't have to show that you are, you have to make a very miskeen face. You have to bring a lot of misery on your face and ask, maybe you can have a few tears in your eyes and say, please help me. Okay. You have to be diplomat. Umar, you have to be a little diplomat. For that, you need to spend some time to study, believe. Yeah, okay. Because only then you can make them work. You will have to ask questions. For that, you need to read a little bit. And then they will, they are not your enemy. I'm not saying that they don't want to do it. They don't do it because they don't take pain as I am taking pain. So every day, people are saying you are wasting your time, but I still come again and again and again. Okay, so I have reduced the number of my discussions. My discussions are for all of you, for all of you, for everyone. Okay, and any topic which someone message me, I try to accommodate. Okay, so my request is that the bottom line is that please have, first of all, give respect to yourself. If you will respect yourself, only then you can expect respect from others. Because unfortunately, it's in baseline mind that you are something inferior than your supervisors. Okay, so then when you are afraid, then you are not able to express yourself. But then you are trusting wholly on your seniors. My senior said, read Morgan, you are not using your brain, that you are not understanding anything. Still, you are following it. So use yourself, use your brain, use your intelligence, and I can guarantee you, you will have very good result. And I'm there to help all the time. I'm there. Okay. So thanks a lot, all of you, for your presence. And if any questions later on it brings to your mind, you are all welcome. Okay. So thank you very much and bye-bye.